So what are some of the causes of tinnitus? One of the biggest causes is ear disorders, and especially hearing loss or noise exposure. I would say the vast majority of patients I see in my clinic have some amount of hearing loss, whether it's in a recordable range or a treatable range, or in some of the ultra high frequencies. And noise exposure and hearing loss and tinnitus all like to hang out together. So a lot of times people who have either had really noisy jobs or are audiophiles and listen to their music too loud, or have had gunshots, hunters, whatnot, usually those high noise levels cause tinnitus or sudden damage to the ear, which causes tinnitus. So that's very, very normal to see tinnitus and hearing loss correlated. But there are also some other conditions, like I actually don't have any hearing loss, and I developed tinnitus when I was about 21 in grad school, which again kind of got me on the path of researching this and specializing in this. And I still have no idea why I have tinnitus. So there are some like me that just develop tinnitus out of nowhere. And there are some medical conditions as well. Patients with TMJ are more prone to tinnitus. Patients that have gone through chemotherapy or have been exposed to what we call them ototoxic agents, life-saving chemotherapies or antibiotics, usually IV antibiotics. Patients that have migraines or had a lot of ear infections as children or still have ear infections, patients that have high sinus problems or any kind of middle ear problems. There are definitely certain conditions that are more prone to tinnitus or tinnitus. So again, that's why it's really important that if you notice that you have ringing in your ears, or even if you're starting to get it occasionally, that you're checked out by a doctor of audiology for a really thorough workup, because there are some medical conditions that they can pick up on and be like, hey, have you talked to the dentist about maybe a bite guard? Have you tried, cervical tinnitus? If you were in a car wreck or something like that, there might be some compression on the nerves or something. So maybe even massage or chiropractic might be an option for you. So getting a good doctor of audiology that has a knowledge of tinnitus or tinnitus, that can maybe look a little deeper and refer to some of those subspecialties to see if there's any medical evaluations that might be an option, is really, really important in your journey. So just wanted to dive into some of the causes. And I think that's why it's so hard to find that one-size-fits-all treatment, because usually when I see a patient, I can't look at them and be like, oh, that's why you have it. There are so many factors, and I think that's why it's so hard to treat, because usually it's a combination of, yep, you probably have some hearing loss, and oh, yeah, there was a neck injury back there, and oh yeah, you had ear infections and you have sinus problems. So it's all these things building into that perfect case scenario of, you have tinnitus. Also, I tend to see it in patients that have more significant emotional issues. It's very interesting. I find that patients that have gone through a big emotional change recently, like within the last 6 months to a year, tinnitus issues can pop up. So one of the things I do is I usually give an anxiety and a depression scale to my patients, and I always ask them, within the last 6 months to a year, has anything significantly changed within your life? Divorces, deaths, bankruptcies, job changes, things like that. And those are the patients that usually have more significant tinnitus or tinnitus. Emotional health is very highly correlated with it. So that's something to keep in mind too. It's easy to think, oh, that has nothing to do with the ears. And really, it shouldn't have anything to do with the ears. It has so much to do with the ears and the rest of the body. So we're going to be digging into that a little more later. But just keep that in mind, that it does have a lot to do with the ears and tinnitus and tinnitus and how you perceive it. So there's a little about the different causes that I ask about, and some more kind of a sneak preview into some of what we'll talk about later.